Hello, today we're going to teach you how to do medical decision making. So medical decision making is when a doctor or a healthcare provider recommends something to you and you have to decide whether you're going to do it or not. So I'm going to teach you some really easy numbers to calculate, and they involve risk, and there are two forms of risk. I want you to focus on the important one, which is called the absolute risk. The absolute risk reduction. So how much is something reduced, your risk, if I give you a medicine or I perform some intervention? Now what you have to be careful about is a sneaky little thing that many drug companies and various other people will present to you is the relative risk reduction. And this almost always sounds better than the absolute risk reduction, and the reason is it's not as important. So if you are able to calculate the absolute risk reduction, which is also known as the ARR, then you can go and calculate the NNT. So we got a lot of alphabet soup here. The ARR is the absolute risk reduction, this one, and the NNT is equal to the number needed to treat. And this is a very important number. It's easy to understand once you get it in your hand, and it can be calculated by simply taking the inverse of the absolute risk reduction, or 1 over the absolute risk reduction. So the number needed to treat, simply stated, is the number of patients that need to take one drug or have one intervention to help one patient. All right, so how are you going to be that lucky patient? Well, you're going to ask your doctor, what's the absolute risk reduction and what's the number needed to treat? And you're going to pick an intervention that has a lower is better, number needed to treat. So let's take some examples. Let's say that you are a 75-year-old man and you have high blood pressure, hypertension it's called. So you're doing just fine, and you go into the doctor's office, and the doctor listens to your heart, and the heart's shaking all around. It's not beating normally. You didn't feel badly, but it's not right, says the doctor. He says you have atrial fibrillation. Well, that doesn't sound good. You say, well, I feel okay, doctor. What's the problem with atrial fibrillation? And he said, well, here's the problem. You could develop a clot in your heart because the blood isn't flowing very well. And that clot could break loose, and it could go flying all the way to your brain. And if it gets to your brain and makes a clot there, then you've got a big problem. You've got a stroke. And no one wants to have a stroke. So if atrial fibrillation is going to cause this stroke, what can you do about it? Well, you could take a blood thinner like Coumadin, or warfarin sometimes called. I think thinner has 2 N's. Let's put it in there. Warfarin is a good blood thinner. Let's prescribe that for you. And you say, whoa, doctor, hang on for a second. I heard warfarin can cause bleeding. Do I really want to take that? And he says, well, you have to take it. You have to take it, he says. Have. Can't spell have. You got it. Have. You must take it. We use words like that. Well, what happened? Why do I must? Why do I have? And he says, because you will have a stroke if you don't take this warfarin. And he said, whoa, wait a minute. What are the chances I'm going to have a stroke? And the doctor says, okay, I can tell you that. Hopefully he can do that. He does a little quick calculation. He said, well, you're 75 and you're male and you have high blood pressure, so you have a CHAD score. That's a thing we do. CHAD 2 is equal to 2. So your risk, your absolute risk of having a stroke in 1 year is, you're going to think it's high, right? Because I just wanted to give you all that warfarin. No, it's 2.5%. 2.5%. Not really that high. And I want to give you warfarin. Well, why would I want to do that? Well, let's look at the risk. Risk with nothing. Well, I just told you that one. That's this. That's 2.5%. How about if I take the warfarin? What's the risk there? Risk with this great drug, warfarin. Well, it should be, that's an F, warfarin. Warfarin, let's try that again. Warfarin. What's the risk if I take this great drug? Well, it should be 0, right? It's going to be perfect? No, nothing's perfect. This is the real world. Your risk is going to be 1.27%. This is per year. Well, what's the difference between those two? Well, it's pretty straightforward. Let's do some simple math. Let's go 2.5 minus 1.27 equals 1.23, and this is the number. That's it right there, 1.23%. That equals your absolute risk reduction. All right, you can do it now. You can go to the next page. It's going to be right here, and you remember that you've got 1.23%, which is really 0.0123. Let's settle that under 1, because it's the inverse. 1 over the absolute risk reduction. This is the ARR, this one here. And that is going to equal the NNT. So do the math real quick, and what do you get? 81. You have to treat 81 patients for a year, for 1 year, to prevent 1 stroke. 1. That doesn't sound that good anymore, does it? This wonderful drug. And why doesn't it sound good? Because before I told you it was a 50% risk reduction. But that was the relative risk reduction. It went from 2.5 to 1.27. That is almost 50%. It's not a lie, but it's not exactly the truth either. The truth is I have to treat 81 patients. So when I look at something like this, I say to myself, well, gosh, 80 of these people weren't going to have a stroke anyway. And they took warfarin for nothing. For a whole year. Did any of them fall down? Did they bleed? Did they have bad outcomes? Those are things to think about. So you need to ask your doctor what the number needed to treat is, and then make your own decision. Let me give you an example of something that works a lot better than warfarin, so you can understand that sometimes it's worth doing things like this. Let's look at oral birth control pills, or OCPs, oral birth control pills. They work fairly well. They don't work perfectly. In fact, not so perfectly at all. In fact, about 9% of women will get pregnant, even if they take the birth control pills, because most people don't take them exactly perfectly, et cetera, but 9%. So you got 9 out of 100 are going to get pregnant. You say, well, that doesn't sound that good, but what's the alternative? Well, the alternative is nothing. And if you take nothing, then how many women will get pregnant in a year? Well, out of 100, 85% will get pregnant. These are sexually active women, and 85% will get pregnant in 1 year. Well, now the numbers are looking pretty good. You're looking at 85 versus 9. So let's do some quick math like we did before. 0.85, remember this is the percentage, so we're going to do the decimal. 0.85 minus 0.09 equals 0.76. That's your number. That's your absolute risk reduction, 76%. So remember, you do 1 over 0.76. That's going to equal your NNT. And this number, oh gosh, it's a fantastic number. It's 1.3 equals the NNT. And NT, there we go. So I only have to treat 1.3 women for a year to prevent a pregnancy. That is almost as good as it gets. That's pretty close to perfect. That's a grand slam. Versus, remember, 88 was our other number for warfarin. So there is a big difference in how things are presented and how much they actually work. Birth control pills, NNT of 1.3. Warfarin, NNT of 88. Warfarin is terrible compared to birth control pills. Birth control pills are 67 times better. So almost all the things we do in medicine can be worked out this way. You need to know the absolute risk reduction, and it's often hidden underneath the relative risk reduction. But if you look at the original documents or make your doctor do it, he can do that math. I encourage you to do it. Please do. Look forward to seeing you next time, where I'm going to talk about some living wills. Thanks for listening, and tune in again soon.